I think it's kind of cool for those that don't know you, kind of like to real briefly say your first name and your specialty, because everybody knows about the wonderful Blasi family, but maybe it's important for people to hear first name and specialty.
Me? Oh, okay. I would normally go from older to younger.
Okay.
Let's go from more mature to mature.
In spirit, you're older.
No, because look, so by having to, like, I'm losing my hair, you know, because we always say the orthodontists work with their fingers, you know, they say do this, do that. But so I'm not an orthodontist, I'm a prosthodontist. So I'm the working man. And my name is Alvaro. Okay, let's restart.
That's good.
We're keeping these bloopers, baby.
No, okay. So I'm Alvaro and I'm a prosthodontist.
I'm Ignacio, I'm the orthodontist.
And I'm Gonzalo, and I'm the periodontist.
Beautiful. And so, guys, and I have to ask, you've been lecturing all over the world for the last couple of years, like literally, you've been like nonstop. What is it about coming to Spear that you think it's going to be different? What does it make it exciting for you to? Is it just another lecture, or why is it that you guys envision this being like a different gig?
So, going back to more than 10 years ago, we met you, that you came to Barcelona. And at that time, we were just students and we didn't know what we really wanted to do. Ignacio was focused on ortho. I was thinking maybe pros. Gonzalo was, I think you were third year?
Yeah, it was third year.
So we saw in that lecture what the power of interdisciplinary dentistry. And that motivated us to going through education, going to the US to go through education, and putting together the philosophy that day we learned from you. So it's very exciting for us because we got inspired by you, and also we've seen Spear Education, how it changed the type of education and the kind of education, how you're doing a lot of interdisciplinary, going through also TMJ that we go through, airway, and you try to combine restorative with the rest of the team and health. And so for us, it's going to be, let's say, challenging to go to lecture at Spear.
And even I will get another anecdote. I think it was 2007, 2008 that we drove to Bilbao.
Oh, yes.
So we were leaving Barcelona at I would say 9 p.m. and we were driving to Bilbao because there was one day full day lecture with Spear, Kokich, and Matthew. And we really enjoy seeing all three of them with three different specialties talking about also interdisciplinary treatment. So we also got inspired with that day in Bilbao.
So it's really excited for us to go to Phoenix and to lecture for Spear Education, seeing all these lectures from the past and how Spear Education has grown so much and inspired so many dentists. So for us, it's really an honor, and we're really excited to go to Phoenix this year.
So what are you guys excited about showing our audience? What do you think is the one area of your material that's going to resonate the most?
I think it's all about when you work in a team like we do and we practice interdisciplinary dentistry in the day-to-day basis. I think it's all about communication. It's communication between specialists, communication with the patients, with the lab. So we're going to show a system on how to improve this communication in order to also improve the outcomes of the treatments that we render. And also to see how we treatment plan, not only how we treatment plan the cases, but also how we sequence the treatments. And that's why communication is also very important for this type of treatments.
Another thing that I will say that we like to show it's also the integration in our treatments, the basis that we have, each specialist, and the integration of the new technology that we're using now.
Because we've gone through what we always been asked: who is the leader? Who is the boss in the team? Like, that was the first question we've been asked in many places. So, I mean, they know I'm the boss, but I'm not gonna say it. But no, we understood it's not about who is the boss, but it's focusing on making the other's life easier by you doing your best. So that's our what we'll say, our principle in the practice. So as a prosthodontist, I need to understand the orthodontist, what he's looking for, what he needs. The same with the periodontist. So by understanding them, I can make my treatment to make their life easier while they're treating the patient.
And I Alvaro got a point here. It's really, I learned so much from these guys here that even the simpler cases that might not be interdisciplinary cases, I can apply little tricks that will make the case even in a much better situation.
So I think it's about calibration between specialties or between specialists. And we've learned so much from each other that now we more or less know how we think, and so we're calibrated between us. So we know, even though I'm not a prosthodontist or an orthodontist, I know probably where Ignacio wants to go with the treatment.
You know, this morning we were seeing a patient with Ignacio, and he was showing me somewhere, and I told him, I think this patient has alter-passive option. So I told him, I think I was a periodontist in my before life, you know? So little things like this that you can capture the other one specialty tricks. So you can call him, hey, I think this guy has this or has that. Because one thing we have in the office is we don't have, let's say, a surgical room, room for ortho, room for pros. Like, all the rooms are the equipment in all the rooms are ready to, like, orthodontist, periodontist, or prosthodontist can treat the patient. So we try to focus on getting the patient in, getting all the treatment, and then she can leave. So we just go in and out of the operatory, but the patient doesn't have to move. So that's something that we are gonna explain how we do this, because we try to minimize patients' appointment by reducing the time and trying to optimize results.
So it's so interesting the way you're practicing, and I love Gonzalo's word, calibration. I think it's all about calibration. But you all can calibrate your perspective in interdisciplinary treatment. The question I have for you is, do you feel one of you is better communicating to patients, or do you feel that because of your system, either one of you could communicate whatever the others are doing the same way? So what do you think?
Tough question.
You know I ask questions.
I think we are different communicators, because some of us have more what we call emotional intelligence, so you can understand more the patient, or what the patient wants, or what the patient feels. So I think we know, let's say we have a small issue with a patient. We know who is the sweetheart, so we send the sweetheart to talk to the patient. And based on the specialties, we understand, like, I understand enough of ortho so I can communicate to the patient. But then if it gets too technical, then I call Ignacio, or the same with the surgery. So I think understanding what are my limits in perio knowledge and ortho knowledge, so I can tell the patient, and then if I need more, I can call Ignacio to improve that communication with the patient. But for us, and we mentioned this a lot, is not communication is not it doesn't get better because of the distance. I mean, you can be very close with somebody but no communication, and far away in another office and get better communication than working in the same office.
I will give you an example of a patient that we treat, for example, with a perio ortho case. that I'll be able myself just to talk about everything, the perio components, the perio surgery, but I would rather have Gonzalo go into details, meet the patient before he goes into the procedure, just to go ahead and fine tune what the patient's expectations are and how he's going to expect after the surgery, post-operatory, and so forth. Don't you think?
Yeah, I think, but again, as we mentioned about calibration, I think we pretty much calibrate in order to give these instructions. But in order when treatment gets a little bit more complex, it's better that the specialist that's gonna do that type of procedure explains to the patient and sometimes to the parent as well how is it gonna go, how is it gonna be the post-operative, and so yeah.
But the nice thing about this is that when I see a patient that is coming from Alvaro or Gonzalo, they already know a lot about what I'm going to be presenting. So it makes it easier for each of us just to talk to the patient and be on the same lines.
But going back,
I'm sorry, one of the things that people want to know, and of course, many of us have gone through those challenges historically, but I guess it would be interesting to hear what you have to say. You know, when a restorative dentist, prosthodontist like Alvaro, or a periodontist like Gonzalo, are able to see that the best possible treatment for a given patient would be orthodontic therapy. But a patient doesn't know about it. And this, of course, in the minds of a patient means longer periods of time. It potentially means a lot of, brackets, mini implants, etc., to get the teeth to where they want them. What are the tips and tricks that you may share with us, being that you guys work in the same office, that allow you to be more, how should I say, your narrative is more compelling for the patient to see, I get it, I should do the ortho part.
So can I say first?
Yeah.
You need to believe in the advantages of the treatment. If you don't believe yourself about the advantages, there is no convincing to nobody. Like we teach in the same university here in Barcelona, and many times we have a seminar on Thursday morning. Many times said, "Oh, we offer ortho to the patient, but they didn't accept." "Oh, we offer ortho to the patient, they didn't accept." And I always tell them, said, I mean, how did you explain that to the patient? Did you really want it? Like, would you do it in yourself? Do you really believe in it? Did you tell them about the advantages? Because if you go to the field with a loser mentality, then you're done. You better not go to the field, you know? So, I mean, for me, the first step is really believe in the benefits of getting through ortho. Because if you only think about more time, inconvenience, more money, because if I think about myself, I think, okay, I'm going to send this patient to ortho. It's going to take him. Okay, Ignacio going to find something on the TMJ, spleen therapy first, then ortho, then corticotomies, then airway, and I'm going to say, okay, this patient going to come back to me
2 years.
In 2 years with no time and no money, you know? Yeah. So if I think about myself and not about the patient, I would tell the patient, you know what? I prep more, I do full mouth rehab, do all crowns, and we're done.
So I think the good thing about the digital technology that we have right now is that we can make the patient aware of their problems by showing them in 3D what their mouth looked like. And also we can take the advantage of using digital technology to show them different treatment strategies that we have to reduce treatment time. So this is one of the things that we're going to talk about.
Yeah, the sequence. If we alter the sequence, we can be more guided and reduce the treatment time. That's because for us.
What happens a lot of the time with interdisciplinary treatments is that these are longer treatments and these are more expensive treatments. And so by altering the sequences of the treatments and using digital technology, we can reduce the treatment time and improve the final outcome precision. And we can make the patient aware of that. And we can improve the acceptance rate of the treatments from our patients.
Yeah. The thing is, I will add to, go ahead, Ricardo.
It's fine, go ahead.
No, what I was gonna say is like I will add into this conversation that if we take time that it takes for an orthotherapy to be completed out of the equation, it really it's really a matter of thinking what is the less invasive approach to treat our patients. So if we move teeth in bone back into the alveolus, and Alvaro has to prep less than he needs to prep, we're really treating with the less invasive approaches to our patients.
So you were mentioning that some years ago, back in the day, Vincent Kokich, Frank Spear, and Dave Matthews did for the dental world. And you three being part of a family and being, I would say, the newer generations of interdisciplinary teams that are really, how should I say, showing a level of care that is inspiring for everybody in the world. What would you say you are doing differently than what was done before? I mean, how do you leverage technology to be able to bring your interdisciplinary cases to the next level?
Yeah. Let me think about it.
That's a tough question. Huh?
No.
I know you can handle. Listen, I know you can handle the.
You know, I think what is important about the digital and the new technology is that we have to still focus on what are the basis of and the concepts and classical concept dentistry, because we can look into these 3D images and get blown up of what's so beautiful, the things that we can do, and we can forget about biology, what is really the basics of what we're taught in dentistry for a long time, and the experience of others that came before us. So I think it's important that we don't lose that focus when we use 3D technology.
Yeah, because technology is only a tool, but you're still only going to see what you know. You are not going to see what you don't know. So you use a 3D scanner and you're going to see a recession, and you know it's a recession because you know about it. If you don't know, you don't see it. So as Ignacio was mentioning, the principles are still the same, which is using technology to being able to alter the sequence.
And
So
help in, better treatments for sure. There's no question about that.
And,
yeah.
and I think you'll see that throughout our lecture that we still mention and cite some of the classic articles in periodontics, ortho, and prosthodontics, and showing more recent papers and some of our papers with using digital technology. So it's having a balance between using digital technology and knowledge on classic dentistry.
And also, one thing that we try to do is being open-minded. Like, I try to be open-minded for the orthodontist, Ignacio, or for Gonzalo. Hey, can we try this? Why don't we try this new thing? I had this idea. So without damaging the patient, we try to do new things also. But you have to be open-minded. Otherwise, you're not going to be able to advance adding digital technology into interdisciplinary treatments. And you try small things, it works. It's like Da Vinci says. In life, you're going to try many things. Many will not work. Some would work, and you repeat doing what works. So that's what we try to do. Try new things and being open-minded for ideas on the other members of the team.
Tell me a little bit, and again, we have little time, but tell me a little bit about how you, Gonzalo, used the word calibration from a vision, from a perspective standpoint. I'd like to ask, utilizing the word calibration when it comes to honorarium. When you have a patient that cannot afford a full-blown interdisciplinary high-end treatment, do you guys calibrate your honorarium in the name of the patient going through X, Y, or Z treatment?
Yeah, I mean, we do talk about patients going through extensive treatment care, and then we try to calibrate the fees. Yes.
What we do is we
more than calibrate, we compromise the fees.
Yeah.
But we always try to give option ideal, intermediate, and compromise also, because and also what we understood about interdisciplinary is not about what the patient needs, but also what the patient wants, because not all the patients that really need interdisciplinary dentistry are interdisciplinary patients. Because how many times you had a patient going through ortho and then 2 months on the road they say, oh, are we almost finished? And you think, oh, maybe this was not the right patient. So we also
all of them like that though.
no, yeah, but we try to see, okay, this patient wants this for yesterday, then it's not an interdisciplinary patient. That's going to be, let's say, only pros or a little bit of perio and pros, but no ortho. So we've gone through interdisciplinary treatment to, is interdisciplinary treatment needed? And is this patient an interdisciplinary patient who's willing to go and walk the extra mile?
I think this is one of the beauties of working under the same roof is that we can, with this type of patients, we can compromise the honorariums or calibrate the honorariums in order for the patient to accept this type of treatments.
So Ignacio, what is the toughest part of being the orthodontist in this team?
Oof. It's really tough to be an orthodontist in here.
Because you have a highly qualified 2 assistants, you know?
Yes,
Because
but I have to tell you that Alvaro used to bond some brackets for me, you know. Gonzalo also, when he does the sutures, I give him a hard time if the brackets are on, you know. So there's a lot of stories behind the scenes here. But you know, one of the toughest things is really to make sure the tooth is in the right place. When Alvaro asked me for 0.003 millimeters, I would say microns, to the left, you know, and Gonzalo asked me just to get the gingival margin just 0.005 high up on the same levels, you know. That's the highest, that's the toughest part of that.
So you're probably one of the most stressful orthodontists there are in
All the
Barcelona.
gray hair, you know.
How about you, Gonzalo? What is the toughest thing about being the periodontist in this team?
I think it's about the same thing. It's about being able to please your referrals. And if your referrals are in the same office, then you're screwed, you know? So
we had this patient one time and we were doing the surgery and I was doing the immediate loading after that. And I was asking Gonzalo, can you do more? Can you do more? Please, 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 can you do more? Can you? And at one time he stopped and said, you know who can do more? David Copperfield. I said, okay, so I back up.
It's magic.
no, so it's also to show them that surgery is not magic and there's nothing, not always the best thing can be achieved, you know, make them realistic about the realities of periodontics and implantology and surgery in general.
Bone regeneration.
Yeah.
And Alvaro, you got to go next. What is the toughest thing of being the prosthodontist in this team?
Just
He's
to
like,
make
he lives like a king
I need
here,
to
you
keep
know.
them straight, you know, straight in line, be on time, finish on time. No, they understood. You know, I was the first one to come back. So I had everything ready for them. So they know who's the boss. So I need to keep reminding them who's the boss.